Okay. And then the last thing that I wanted to cover real quick before we get into the lecture is the internship hours. So you guys are expected 50 internship hours, okay, which means that you have to do 50 hours either observing or hands-on at a local dental office or in this office. Now, we're going to give you guys the opportunity to do all of the hours here if you choose to. When you come in here, you're going to be just like an assistant. And we're real sticklers about this. Professionalism has to be at its highest because people are paying their money to be here, and they don't want to feel like they're being experimented upon. Okay, so we never call you guys students in front of the patients. You guys are trainees, or you're in training. So I'll introduce you to the patient. If you guys are observing and standing behind my back, I'll always ask the patient if that's okay. I'll say, so-and-so, I don't know your names yet. I'll say so-and-so, Mark. I'll say Mark is a dental assistant in training. He's going to be observing. Is that okay with you? Or Mark is a dental assistant in training. Do you mind if he assists on this procedure? 99% of the time they say, yes, that's fine. In fact, I've never had anybody say no. But that's the way we're going to approach it. We're not students. We never say, I'm doing this for the very first time. Try not to say, oh my God, I'm so nervous. I can't believe they're letting me do this. So try to be as confident and professional as you can. Okay, and that kind of spins off into attire. You guys got a voucher for Scrubs. Scrubs for Less is the place on Highway 69. You can just go in there. You can spend anything less than $30 on Scrubs, and you can get a nice set of Scrubs, tops and bottoms for $30. And just hand them that receipt, and you're good to go.
Any color?
Any color you want. You guys can get crazy and funky. My staff all wears black with the emblem, but you guys can wear whatever color you want, and you can wear whatever color you want while you're assisting here at the office. Okay. So if you guys have a friend that's a dentist in town, if you have a good relationship with your family dentist or your child's orthodontist or something like that, feel free to ask them. I mean, I know every dentist in town, so just say, hey, I'm with Dr. Costas' dental assisting school. Do you mind if I observe or help you out? And most times they're really anxious to get you guys on board and help out around and help clean up and help chart and file and stuff like that. So most of them are really open to it. And if they're not open to it, don't worry about it. There's 99 or 100 dentists in this immediate area that you can ask. If you want me to set you up with an internship, I can. If you don't want to deal with any of that, come on in here and you can do all 50 hours here.
Question: we don't get paid for any of that, do we?
No. That's a non-paid internship. Okay. All right. Okay. So, no, that's a good question. So you'll find a sheet here that says externship competencies. These are the things that we're going to want you to either observe or participate in during your externship. Again, it says 40 hours of chairside dental assisting. It's actually 50 hours. That's a typo. So the things that you're going to need to cover is the patient interview, review of medical history, sealant placement, and all of these terms, if you don't know them, don't worry, you're going to learn them all. Periodontal or dental hygiene procedure, full mouth series of x-rays, comprehensive exam, operative procedure, endodontic procedure, oral surgery, removable prosthodontic procedure, fixed prosthodontic procedure. So all of those things you guys are going to need to either observe or participate in. Now, the first 10 hours or so, I'd say it's fine. Stand over the doctor's shoulder and watch. After that, you should probably try to get your hands in there and do some of the assisting, because if you spend 50 hours watching somebody do something, it's not as valuable as spending 2 hours actually getting your hands in there and actually doing it. So do as much of that as you can. Okay? Hands on. Gotta be rested. Okay? All right. So that being said, I'm going to introduce myself really quick and my staff here, and then we're going to go around the room and have you guys do the same so that we all know each other. After you guys know each other, you'll have about 30 seconds to decide who you want your partner to be. Then you're going to partner up, and then that's going to be your buddy for the whole semester. You're going to take x-rays on each other. You're going to be doing a lot of stuff on each other, so make sure it's somebody that you can stand. All right, so you'll have 30 whole seconds after the introductions to decide who you want that to be. So anyway, my name's Mark. This is Darla, and this is Jessica. like I said, Darla and I started the school 4 years ago.
4 years in April.
4 years in April, wow.
Yeah.
And we do pretty much 4 classes per year. The class sizes range. But like I said, I think we have over 200 graduates now, probably, close to.
Yep, I would say so.
Yeah.
Because we've had, well, yeah, I would say we're pretty close.
Okay.
And a lot of them are out there working.
A lot of them. And the ones that aren't are the people that either didn't finish their hours or just never followed up and never continued to pursue the job. You'd be surprised how many people just kind of lose interest after spending the money and the time doing this. But the people that want a job always work. They always get work.
Right.
And we'll help you with that as much as we can. We'll help you with your resume. We'll have it on file. And I'm telling you, all the dentists in the area, before they even place an ad in the classifieds, they call us and say, hey, you got any good graduates? And we'll just fax over a resume. That's how most of the people get their jobs. And a lot of times, people get their jobs before they even graduate. Okay. And those are always the cocky ones that are walking in, like, I'm too good for this place. I don't do this. Yeah.
How could you get a job before you graduate?
You don't need to have certification to have a job in dental assisting.
Okay.
So in the state of Arizona, there's no necessity for a certificate, but it does help a lot to get your foot in the door, because I know for me, I don't hire anybody without dental experience.
So how far into the class do you have to be to get a job?
You can get a job now if somebody will let you in the door and hire you. But the more you know, the more confident you are, the more helpful you'll be in the office, the more likely you are to get a job. Good question. Okay. So I'll start with the introductions with me. My name's Mark. I own 3 dental practices. I own this one, Chino Valley. I have a practice in Williams, and I have a practice in Flagstaff. I live in Prescott Valley. I have 2 other dentists that work for me, Dr. Yap in Flagstaff and Dr. Osga in Williams. If you guys want to go volunteer there, they'll be happy to have you there too. We have this dental assisting school, and like I said, I also provide this as a license to dentists across the country. It's growing like crazy, and I think pretty soon we'll be in all 50 states. So we're very busy. I have 3 boys. Bryce is 5, Brendan is 3, and Brady is 10 months now. So I'm busy on that front too. I'm a San Diego Chargers season ticket holder, so I'm there a lot. We have a second home in San Diego, so we're there a lot. That's where my wife and I met, and we went to college there, so we have a lot of friends there still. I like to surf, and my newest hobby that I'd like to get a little bit more into is skydiving. And
we just don't want him to.
yeah. And